Yeah, thank you so much for giving us your time. Maybe let's start with who you are and what you do.
Thank you for having me. And I'm Dr. Kaseya. I'm the Director General Africa CDC based in Addis Ababa.
So here, this is the inaugural Africa Climate Summit, and the public out here would want to know how do you how do you connect the two, and maybe as the discussions go on, what should they expect?
Yes, coming in Nairobi for the Climate Change Summit is also to reaffirm that there is a huge impact of climate to health sector. This is why Africa CDC is promoting what we call One Health approach. One Health approach is bringing the human, animal, and the environment. Based on all studies that we have, we know that the next pandemic is coming. I have to repeat to everyone that other continents they are getting ready. Africa must be ready. And this next pandemic is what we call a zoonotic one. It means a transmission from an animal to a human being, and it will be worsened by the climate change. And this is our responsibility, our collective responsibility to promote the One Health by bringing the three components and making our countries more resilient on the effect of climate change and being also more proactive on the way we are managing the health sector by considering the impact of interaction with animals and the climate change.
So, when you talk of the next disease, obviously there are policymakers across the continents, member states that you work with. What are you exactly saying they should do?
Yes, my message to our head of state, my message to our ministers is clear. First is to sensitize people. You know, when people they don't know, they won't take appropriate action. We are sharing information. We are talking with head of state, with our ministers, with our population to say, let us be ready. The next pandemic is coming. The second action is, yes, we sensitize, we give information. We need now to start to take some further actions. And the action is to implement this One Health approach. We have a number of activities that will help us to implement that. The third one is to dedicate funding for that. We know the climate change summit, it's not about environment. It's also about other, interaction with other sectors. How we can dedicate funding for the health sector linked to the climate change. And the fourth one is how we can work together. Because the health sector is not just Ministry of Health. It's this coordination, multi-sectoral approach, and that will bring us together. This is what we are promoting, and this is our message. And even we have a side event on climate change and One Health on the margins of this summit.
So when you talk of the next disease, or maybe the pandemic, whatever form it will take, are you saying this is because climate change effects are worsening?
Yes, I'm saying that, and I confirm that. And we have some disease now. Let me talk about the discussion I had with CEPI. CEPI is one of the biggest organizations on the vaccine manufacturing. They are working on what we call the Lassa fever vaccine. But we see that in a number of African countries, the Lassa fever is growing. And even this was an African disease, but we discovered 3 cases in the UK. And because we have the effect of climate change, and you saw the article from Peter Sand from Global Fund saying that it won't be a surprise that in Europe and the US, they will see cases of malaria because of the climate change. Yes, climate change is affecting the health sector. We need to be to work together. We need to see what kind of actions we can take to avoid this impact of climate change in our life.
So going forward, maybe after here, because this is the Africa Climate Summit and the lead up to COP28. Yeah, we've had the similar climate talks before. So how do you make sure that you voice actually the message goes across?
The first one, I really expect that when they will read conclusions of this climate change, there will be a paragraph on the health sector. This will be the first success for us. The second one will be Africa to bring strongly the voice to COP28 to talk about how we are affected in our well-being, in our health, regarding this issue, this topic of climate change. You know, I have to say to people, COVID is a major lesson for all of us. During COVID time, it was a total lockdown. Even the economy was down and all other activities were down. We need to be prepared. If we neglect the impact of climate change to the health sector, when there will be another pandemic, everything we are doing today will be down. But if we are well prepared, we can now be ready to respond to the next pandemic or to prevent the next pandemic with appropriate actions that we must take from today.
Okay, so when you talk about all this, then you're saying they need to actually put in resources and create awareness. I want to understand how, as Africa CDC, you're deploying technology to be able to create the awareness that is needed around all these health issues that are pending and those that we've been facing that are still with us.
Thank you very much. You know, we are innovative in Africa CDC. And we believe that the digital program, we have a strong digital transformation agenda. And we need that one can contribute to mitigate the impact of climate change. You know, linking people. Today we have young people using Instagram and other social networks. We have also some other older people using WhatsApp and others. We need to disseminate information. We need to disseminate, we are disseminating information, we are disseminating what they have to do to change their lifestyle and to be prepared and to prevent the pandemic. Yes, the innovation, the digital platform, and any kind of innovative approach that we can have will help us to address the issue of climate change. Yeah.
So when it comes to fighting diseases and obviously the pandemics that we are having and those that we might have, how does technology come in? How do you, we've seen it being used in telemedicine and all these issues, we've seen it deployed during COVID. So how do you plan to actually go on to use it to fight the disease specifically? Yes, the awareness, you've tackled it, but the fight of the disease.
We have three components. We have the prevention, we have the curative one, but we have also the promotion. In terms of prevention is when people, they must get vaccines to be prevented against, some diseases. The best way to use to attract people to ensure that they will get these preventive measures is to use the technology. This one we talked about the awareness. About the promotion is to use some digital platform, like TikTok, to start to even to play. I saw a program that was developed for young people, to give them some games, and these games will teach them on what to do and not to do for them to prevent what the climate change is having as impact in our life. The curative one, with COVID, we saw a lot of things changed. Even our meetings are virtual now. But we have also the telemedicine. The telemedicine, this is a major component that Africa CDC is developing today. We have a shortage of health workers. We have a shortage of specialists. But I want to make sure that if I have a specialist based in Nairobi and myself I'm in Mombasa, how can I have access to him? And we are creating this platform. It means in the three components of the health area, the digital, the innovation is coming strongly to support the agenda. And even we are using drones now. This is another innovation to transport medicines, vaccines from an area to another one. There is this strong program, and we are approaching that carefully. We are discussing because these programs we need also to address the policy issues at each country level. We need to make sure that all countries in Africa we are aligned. In the European Union they did it, but in Africa we are working on that. This is why we are sensitizing also our policymakers to integrate like telemedicine, like use of drones in their policies, and to also integrate the digital platform for collecting data and sharing data. And the Africa CDC is putting in place a big data center to collect information and to use that for appropriate action. You can have an outbreak here today, but if it's not timely reported, this outbreak can affect other countries. And this is why this program, the digital program, will help us to have appropriate information on a timely basis for decision-making process.
Is the next pandemic preventable?
We are working on that. We know that the next pandemic, this is a probability. We say maybe for 75% the next pandemic will be a zoonotic one. If we know that's a zoonotic one, what is the action that we can take? To develop a vaccine for animals. I was meeting President Masisi a few days ago in Botswana. Botswana is one of the lead countries in manufacturing vaccines for animals in Africa. If you can vaccinate your dog, if you can vaccinate your cat, that one will help us to prevent the next pandemic. But let us start with what we can do. This one is doable, and then we can see how to prevent with what we can't do.
Okay. Maybe this which is in Kigali, it's headquartered in Kigali, and we've had people talking about it and having it operational. Some updates?
About what?
The this.
The African Medicine Agency.
Exactly.
We need African Medicine Agency from yesterday. Why I said from yesterday? Because if the agenda in Africa today is to manufacture our vaccines. I have to say to our people, our leaders, out of 100% of vaccines we are using in Africa, only 1% is manufactured from Africa. Only 1%. And this one is exposing us because when there will be another pandemic, learning from COVID, all other regions or continents, they will lock themselves. And we won't have what we need to have. We won't have vaccines. We won't have medicines that we need to have. This is why we need, while we are manufacturing this vaccine, we need a strong regulatory body. This regulatory body will help us first to certify the quality of the product that we are manufacturing. Second, to help African countries to trade among themselves. And without a strong armor, we won't achieve this agenda. This is why we are advocating for the operationalization of armor very quickly, and Africa CDC is fully supporting this agenda.
What's lacking? Because, understandably, there are resources that are needed, there are professionals and everything. We somewhere.
Ongoing process. Sometimes process, can take time because we need also other countries to sign, to agree, You know, I think we are getting there.
Thank you so much for giving us our time.